Article that we ran in our March issue of this year called A Bitter Pill. And basically the article was a discussion, and it was written for physicians, but it was a discussion of the many different ways that insurers will prevent you from getting the medications that your physician has prescribed to you. So this is meant to be more of an educational session so that you can understand possibly what's going on when you get a denial, and then therefore be better armed to try and fix the problem. Basically, denials can take many different forms, but these are the key ones that physicians are seeing and patients are seeing. And I'm sure you guys have all seen this, is a substitution for a generic. Your pharmacist may put that on you, your doctor, anybody can say, oh, well, here's a generic and it's cheaper. And the thing with the generic is that the FDA requires that the generic drug have the same amount of active ingredient as the name brand drug, but they do allow a 20% difference in composition of the drug. And that may be how it's released into your system, or the time it takes to release into your system. It could be preservatives, flavorings. I mean, there are a variety of different non-active ingredient ways that a generic can be different. And different people, as you know, react differently to different things. You may have an allergy to some preservative or flavoring that might be in a generic that could cause an issue. Or it could interact with your other drugs differently than something your physician might expect. And for a long time, people have not thought that generics were a problem. They've always thought they've been very, very safe. But there have been recent studies that show that is not necessarily the case. One study showed that there are increased overall hospitalizations for patients that have been switched to a generic from a name brand. Another very recent study in 2007 said that there was a 30% risk in major cardiac events when you switch from Lipitor to the generic simvastatin. And that's a very recent study. Studies that are coming out saying generic drugs may not be as safe as we thought they are. The other substitution method is what's called therapeutic. And therapeutic, the drugs do not have to be equivalent as far as active ingredients. They are not, so they're not chemically equivalent drugs. Generally, when a therapeutic substitution happens, it's because it's a less expensive drug. It's usually an older drug, and it may often be a drug that was originally prescribed for a totally different reason than the reason that your doctor is prescribing it to you. Formulary changes, these are incredibly confusing because they can change on a whim. Your insurer can decide to drop a drug off of what they have said that they're going to pay for off of their list. They can change a drug, and even if it's on their list, they may opt not to pay for it. They may just say, not going to pay for it, we don't want to. And there's no real rationale for it. So it's very, very, very confusing. There's also the issue of some drugs that are FDA approved for some conditions. The insurers will say, no, we're not going to pay for it for that condition. So it gets... This is probably one of the most confusing areas for trying to figure out why a drug specifically was denied. Prior authorization. Some insurers will say, sorry to the doctor, sorry, you didn't have prior authorization, you just prescribed this drug, you didn't ask beforehand. And this, again, is another kind of scary one, because even if they then go in and try and get that authorization, it can take months before they can get the authorization. So it may be months before you get the drug that you need based on a denial for prior authorization. The other issue with this is that most people don't have a choice to change plans. And there are many reasons you may not even want to change plans, but if your insurer says, sorry, we're no longer covering that, X drug that you really need and your physician wants you to have, you may not be able to change the plan that does allow that drug. Fail first and step therapy. This is the problem where a doctor will be forced to recommend a less expensive drug, or the insurer will require the doctor to prescribe a less expensive drug before going to the more expensive drug. So you have to basically prove that the less expensive drug, whether that's aspirin, or in the case of Hytrin versus Flomax, does not work before the insurance company will let your doctor prescribe the next expensive drug. And the really scary thing with this is not just that, but if you change insurers at some point during this process, you may be forced to start over again. The other issue is that of medical reviewers. A lot of the insurance companies will have third-party medical reviewers that look at your records and say, oh no, this person can get by with a lesser drug than what the doctor is really recommending. And this is a person that's never seen you, doesn't know you, is not familiar with your case. Then there are also medically based, what I call medically based patient come-ons, and these take the form of advertisements. I mean, you guys have all seen them. Ask your doctor today about X and X drug, and those are come-ons from the pharmaceuticals. And what they want you to do is to go into your doctor and say, no, I really must have this drug because the TV told me so, or the ad told me so. And it puts doctors in a very, very bad position. Either they have to do what the patient wants, or they have to really convince them that no, you don't want that, and possibly lose the trust of their patient. So what can you do about this? It's not that it's hopeless. In California, pharmacies can only switch you to a generic drug if the doctor has not indicated that the prescription must be filled as written. So when you go into your doctor and he writes out a prescription and he's doing it for a name brand, make sure that he is writing that down on the prescription form. If your pharmacist suggests a generic, you do not have to take it. You can say, no, I want the name brand. And they will let you know whether your insurance will pay for the name brand or not, and you can make an informed decision at that point about what you want to do. You can definitely have your physician be your advocate. Many physicians out there are spending, unfortunately, inordinate amounts of time with red tape and paperwork trying to get insurers to cover the treatments that they want for their patients or the drugs that they want for their patients. So definitely make sure that your doctor is being your advocate and is writing letters or making phone calls on your behalf. Definitely, you can do the same yourself, and certainly being a squeaky wheel is a good thing in this case, and never give up. I mean, you can make numerous phone calls to an insurer to try and get them to change their mind on what they're doing. You can write out well-reasoned letters based on what your physician has said. You can hit them on the head with the point that that they're not physicians. They haven't seen you personally. That they are in essence practicing medicine, and they shouldn't be. So you can definitely, like I said, hit them up with a lot of different things, and I highly suggest